Welcome to module number 5, adjusting. This is probably, it's one of my favorite. And the reason I say that is because it's where you get results. Results are your reputation. It's also what your patients are looking for. I feel like we have so many advertisers and marketers that can drive new patients to your practice. But unless you can deliver results, you're not retaining them. And so that just speaks volume. It's also the biggest deficit I see. I've worked with 5, 6 associates at this point, and every one of them needs lots of work. And most of them are brought out of school, but they need tons of work on getting their adjusting. It's just not something that's taught anymore, especially hands-on, old school. Just get results, get in tune with healing. You're a healer. And so I've written down some things that just kind of go along with this. But I think another thing that I think about is, you know, there's so much blood in the water. How do you change yourself from being a commodity to being this niche, unique individual that is delivering an art, a healing art to your community, and how you separate yourself and look different? And I think that a lot of it is your results. Yes, you could do it with your tech and maybe your thermography and your EMG and your x-rays and digitization, but when you're doing this in a subluxation-based model and without all the different therapies and different equipment, how do you differentiate yourself? You differentiate it through your art. Your healing art has to look different than the next dudes down the street or the next gals down the street. And so here's some of the things that I just think that are important. I get adjusted the way I want to get adjusted. I teach adjusting the way I want to be adjusted. And so things that you have to have inside of that, there's a long laundry list of things, but I want that adjustment to be effective. I want it to be precise. I want well-intentioned adjustment. I want it to be comfortable and smooth. You cannot be hurting your patients. You can't be delivering these hard breaks that just light up the room that look great to other chiropractors but are shitty to the patient. So we want smooth. It needs to be effortless, and it needs to be one with the patient. I think, or I know that what your intention, your mindset when you're delivering adjustments, you know, what are you thinking about? Are you thinking about proprioception and making sure that that brain is aware of that body so that innate intelligence can bring about healing and change? That's what you're doing. You're putting your hands on the spine. You're wanting that brain to light up and be aware of itself, and so it can produce the information, the life-giving rivulets of just innate to make things change. So I use a hand-on technique. I like good feedback. I don't like instrumentations. I don't like blunt things I don't like intermediaries where I like to get my hands on that. I like to feel. I like my innate to assess their innate. I'm looking for the path of least resistance. We'll talk more about that when we start adjusting. We want to know where to go in. Where does that body want us to go in?